So leaky gut is a condition involving the GI tract that can lead to other chronic illnesses, especially lupus and other autoimmune conditions. As more people have exposure to poor diet choices and toxic environment, stress, and microbiome imbalance, leaky gut is affecting more people than ever before. What's more interesting is that the medical community is just now recognizing this condition as a potential threat, causing various conditions, again, like lupus and various autoimmune conditions. Despite the fact that the concept of intestinal permeability has been acknowledged in the medical literature for over 100 years. So, leaky gut symptoms list. So the Eastern medicine and the father of Western medicine both agree that all disease begins in the gut. And more research is proving that this is actually true. And our gut is protected by tight junctions that serve as a barrier to your intestine and determine what passes through into our body. And these tight junctions keep our body safe from harm by keeping out toxins, bacteria, undigested food particles, and various other threats that can trigger our immune response. Think of it as having broken doors and windows in your home. The various insects, rodents, and dust that should remain outside of the house now begin to enter the house and grow in numbers to a point of chaos. This leads to our immune system causing inflammation in our bodies in an effort to fight the toxins, as an example. Leaky gut is associated with the following conditions like allergies, asthma, autism, autoimmune diseases like RA and lupus, rash, eczema, and psoriasis, inflammatory bowel disease like irritable bowel syndrome and Crohn's, celiac disease, Hashimoto's, rheumatoid arthritis, and type 1 diabetes, to name a few. So among the symptoms, 7 symptoms of leaky gut. Number 1 is food sensitivity or intolerance. You may be eating foods that you are sensitive to, and medically, only the true allergies are diagnosed in which you experience an anaphylactic shock after consuming peanut butter, for example. But research is proving that more people are developing low-grade antigens to the foods that they commonly eat, and this is because of leaky gut. And the difference here is between IgG reaction versus IgE. The latter results in immediate symptoms such as hives, difficulty breathing, etc. And food sensitivity is very common due to increased leaky gut prevalence all over the world, which is often overlooked in the medical community. The symptoms of food sensitivity can be non-GI related, such as fatigue, headaches, mood swings, etc. Number 2 is autoimmune disease. The link between the leaky gut and autoimmune diseases largely involve a protein called zonulin. And according to a 2011 article published in the medical journal Physiologic Reviews, zonulin is proven to be a modulator for these tight junctions in our gut. When zonulin levels rise, a doorway into our body opens up, and dysbiosis, which is imbalance of the gut microbiome, and gliadin in gluten is ultimately responsible for increasing this protein called zonulin, potentially leading to autoimmune disease, inflammation, and potentially cancer as well. And this is why eating gluten with weak probiotics in the gut can trigger this dangerous cascade. The University of Maryland School of Medicine researchers have uncovered that gluten activates zonulin signaling despite a genetic disposition to autoimmunity, leading to leaky gut. Number 3 is inflammatory bowel disease. More evidence is emerging that the leaky gut is responsible for triggering irritable bowel syndrome and ulcerative colitis. Some research also states that leaky gut is prevalent in Crohn's disease patients as well as in their family members, between 10 to 20%, which implies a potential genetic component. Number 4 is thyroid disorders. If you have Hashimoto's, this can be due to leaky gut as well. Hashimoto's is an autoimmune disease that causes lack of thyroid hormone production in the body, leading to fatigue, hair loss, and weight gain. Number 5 is nutrient deficiency. If your gut is leaking, it's likely that there's limited absorption of vitamins and the minerals from the foods. Common deficiencies include vitamin B12, magnesium, potassium, zinc, selenium, and vitamin C. I recommend a supplement to close the gap along with a good quality probiotic to protect you. Number 6 is skin irritations. In Eastern medicine, any manifestations of irritation on the skin suspects gut disorder. This gut-skin connection is because the gut is the first line of defense, and manifestations of irritations on the skin show up on the skin, including psoriasis, acne, and eczema. The typical medical solution is to prescribe toxic creams and medications when in fact they can be healed over time by repairing the gut. Lastly, depression, anxiety, and neurological disorders. According to a study published in the Journal of Neuroendocrinology Letters, leaky gut was suspect in causing various neurological disorders. The leaky gut causes inflammation leading to malabsorption and nutrient deficiency, which collectively impair the proper neurotransmitter synthesis for a healthy cognitive behavior and moods. So, conventional medicine bias. The medical community considers leaky gut a mystery. According to Dr. Donald Kirby, who's an MD, who is a GI doctor and the director of human nutrition at the Cleveland Clinic, physicians typically don't know much about the gut, even though our intestines are the biggest immune modulators. All in all, the medical community chooses to leave it as a mystery disorder as they don't have a specific treatment at the present time. It's important to note that medical practices focus on standardized criteria for various diseases. They rely on prescribing drugs to relieve the patient's symptoms, and since there is no set criteria for this prevalent dysfunction, they rely on Prevacid, antacids, anti-inflammatories, and antidepressants and hope for the best. So what can you do? Most people do have a certain degree of leaky gut. This is from my clinical experience with treating patients for the last 19 years. But for us, lupus patients, it's a good idea to assume that you do and take all precautions. It starts with getting on a clean diet to repair your gut lining. This is to minimize the potential inflammatory reactions in the body and to allow for healing. A good probiotic along with a complete vitamin is ideal as well. So I hope you found this article helpful. Please share, like, and subscribe to my blog and social links, and also subscribe to my YouTube channel today. Talk soon.